There's a provision in the new health care reform law which could spell relief for millions of nursing mothers who work. Lisa Sylvester is back with some details. What's this all about, Lisa?
Well, finding a private place to pump breast milk at the workplace, this is an issue that women's groups have been fighting for years. Well, they found an advocate in the junior senator from Oregon who got it done. Tanya Hurd is a working mother of two who nursed both of her children. When she returned to her job as a retirement plan administrator after the birth of her daughter, she faced a major challenge: finding a place to pump breast milk at her workplace. If she was lucky, she used someone's office. Unlucky days, a public bathroom.
The only plug in the room was above the counter between the two sinks facing this huge mirror. And so I would have to stand there pumping in a place that's public, or that where strangers can come in and see you, with your shirt off and, pumping. It's really hard. I mean, it's so hard to describe.
Tanya has since joined a group called Nursing Mothers Council of Oregon. The group helped lobby for changes. Now a requirement in the health care reform bill signed into law will make it easier on nursing moms in the future. The provision requires employers across the United States to provide a lactation room, a private space other than a bathroom, for women to pump milk for 1 year after the birth of a child. Employers will also have to provide workers with reasonable break time. Companies with fewer than 50 workers can ask for an exemption if the new rules create an undue hardship. Oregon Senator Jeff Merkley says his own wife, who was a nurse, had trouble finding privacy and flexibility when she went back to work. He inserted the language in the national health care legislation.
This is just one of those really common sense approaches to health care. So often we're focused on sick care, how to help people get well who are already sick. This is one of those investments that costs virtually nothing. It's a cultural change that has a huge impact on the health of our children, health of our mothers. And so I guess it's something we should have done this 20 years ago.
24 states already have laws related to breastfeeding in the workplace, according to the National Conference of State Legislatures. But at least one business group has come out opposed to the new federal mandate. The National Retail Federation says reasonable employers already accommodate workers without the need for new federal standards, adding, quote, "Every additional mandated rule further burdens employers who are struggling to keep jobs afloat." Now, the Labor Department will have to write out the regulations specifying, for example, what is a reasonable amount of break time and defining undue hardship. The new rules are expected to take effect in about 6 months.
Interesting story. Thanks very much, Lisa, for bringing that to our viewers.